what is the effect of the sympathetic nervous system, so sympathetic nervous system, on the respiratory system in a healthy person? So all of these things that we underlined here are important for different reasons, and we'll go through it. So this first part, sympathetic nervous system, remember that that is your fight or flight response, as opposed to your parasympathetic nervous system, which is rest and digest. So when we think sympathetic and we think fight or flight, we're thinking of a situation where someone, their heart rate is increasing, their respiratory rate's increasing, they're getting ready to fight off a predator, going back to ancient times when our bodies were designed to fight off predators. We could decide to fight them or we could flee. And all of that from back in the day still comes back to current time. When our body senses a threat, we amp up into this fight or flight mode and decide if we are going to fight off the predator or we're going to run away and flee. So we're going to think about that when we go through the choices of which one matches a fight or flight response. Then we also need to note the respiratory system, because all of these choices are going to have to do with breathing and respirations, and we want to see which one matches what we are looking for in this fight or flight response. And lastly, it is important to note that this is what occurs in a healthy person, because some of these options are things that happen during a disease process, but we want to see what is considered the normal level of functioning. And knowing all of these three things, let's see if there's any that we could eliminate. So let's start with looking at this part, healthy person, and let's see if there's any options that we can eliminate, because we see that these are not normal functions that happen in a healthy person. So right away, I'm seeing Kussmaul respirations and Cheyne-Stokes respiration breathing, which are both not normal levels of functioning that should not occur in a healthy person. Kussmaul respirations is a type of rapid and labored breathing that is very specific to a condition known as DKA, or diabetic ketoacidosis, which is an emergency that occurs usually in type 1 diabetes when the blood sugar levels are extremely high to the point where the body is going into ketoacidosis, meaning ketones are like a protein and the body starts to break down protein in place of the blood sugar because there's just so much that the body can't access because of low insulin levels, and that leads to Kussmaul respirations. So this is in fact not something that should occur in a healthy person. This is not a normal response, so we should eliminate it, because when we're looking at fight or flight response, this is a normal bodily process that is designed to happen in a person normally. Not all the time, it wouldn't be normal to constantly be in fight or flight, but as needed, this is a normal body response to go into fight or flight when necessary, and something that would happen in a healthy person. So any option that we see that seems very abnormal, we could eliminate, such as what we did with Kussmaul respirations. Taking a look similarly to Cheyne-Stokes respirations, this is also deep, rapid respirations that are not a normal breathing pattern. This usually is a sign of some sort of underlying condition and could potentially mean that there's impending death for this patient, that they could start crashing with these types of respirations. This is emergency, this is not good. And the reason for that is because these deep rapid respirations could lead to apnea, which means no breathing at all, which is a true emergency, not a normal finding that you should see in a healthy person. So we could eliminate option D as well. So now we have eliminated two options and we are between bronchodilation and bradypnea. So now we already addressed what we would see in a healthy person, in a normal person, and we eliminated options that we would not find in a healthy person. So now we can move to another point on this list in the question that states sympathetic nervous system, meaning we want to find between bronchodilation and bradypnea which one would occur in a fight or flight response versus which one would occur maybe more so in rest and digest in the parasympathetic nervous system. So let's break it down. If you are in a position where you really do need to fight off some sort of predator and your heart rate's amping up and you're getting ready to fight or flee or run and you have to move, do you want more oxygen and more air coming into your body to use and bring energy? Or do you want less? Do you not want to have as much oxygen on hand? You would want more oxygen and you would want to have more breaths to take in to give you more energy and be able to fight off what needs to be fought off. So for that reason, Looking at bronchodilation, broncho is the bronchus part of the respiratory system, and dilation is opening. So this is allowing more air in. And if you think of a bronchodilator medication, such as albuterol, that opens up the airways and allows a person to breathe better. So therefore, this would allow for increased respirations, increased O2, better breathing. So better breathing. Which sounds better for this fight or flight versus bradypnea, because brady means low or decreased or diminished, such as bradycardia would be a low heart rate, and an apnea is respiration, so decreased respiratory rate. So you wouldn't be breathing as much, you wouldn't need as much. And in certain situations, your respiratory rate maybe would decrease, possibly during rest and digest, maybe not so much to the point where you are actually bradypneic and you're breathing at a low respiratory rate, because you wouldn't want your respiratory rate to drop too much, but it just wouldn't have to be as much or as fast or as rapid as you would during a fight or flight response. So possibly rest or digest, but more so not even really a normal finding. You wouldn't want to be breathing very low respiration rate. So bradypnea would not be a correct choice. Bronchodilation would be the best choice of what you would find in a normal healthy person during a fight or flight response for all of these reasons. So option B would be the correct answer for this question.